How much is that a month?
Talking medicine
Here is my Dilantin. It's a generic called Phenatoin.
and money.
It still costs me $90 for 30 days.
It is a familiar topic for Carrie Wilson. She has antiphospholipid syndrome. Inside, her body thinks it is bleeding when it isn't. She takes 16 medications a day, swallowing 27 pills.
If it runs anywhere between $800 and $1,200 a month for my medication, but if I don't have that medication, then I could die.
Taking and paying for the meds is not a choice for Carrie, but prescription drug costs do impact decisions made by patients and doctors. Physician Garth Morgan has to take everything into account when writing a script.
One, what's the best thing for the patient from a medical standpoint? What's the best thing from a patient from an overall health standpoint? What's the best thing for them they can sustain?
And ultimately get better without going into debt.
It's the same class,
Pharmacist
so
Jill
you're gonna have to
Moots
stick
deals
with the
with
first
people
one.
every day trying to avoid that.
Cost is the big factor for most people when they're picking up a prescription.
So to help patients get medications that would be financially out of reach, there are coupon cards or rebate programs for certain brand name drugs. While there are some catches, a patient could pay hundreds of dollars less to get their meds. Another option, don't go brand name.
If you're someone who's paying out of pocket, most of the time your answer is to go with a generic and to really advocate for yourself that I can't afford these medicines. We've got to find something that'll work for me.
Take this approach. Think about buying medication like a car. You want the best price, so you need to shop around for it.
Most people don't know how to go to a pharmacy and say, well, if we're paying cash, how much is this medicine? And then I can go down the street and ask if we're paying cash how much a medicine is. And it could be $300 difference.
But be careful. You don't want to have 10 pharmacies with prescriptions at each. That's dangerous with drug interactions.
You have to look at your overall, prescription profile and, really try to find the pharmacy that's going to give you the best price overall for all of your drugs.
For Carrie, it's a plastic bag full of generics, representing many lessons learned, money spent,
Shop around. Shop around.
and saved.